Hey Vesper fam, it is Friday and it is time for Ask Dr. Drug Dealer. And on today's episode, one of the most contentious things that happens in the pharmacy and we get asked about all the time, prior authorizations. Was that good?
Yeah, that works.
So believe it or not, prior authorizations actually don't have anything to do with the pharmacy. That's when your insurance carrier requires additional information or paperwork from your prescriber in order for them to fulfill the medication order. So medications that require approval will only be approved by your plan if the doctor requests approval. Some of those medications are medications that have lower cost alternatives, drugs that are typically abused, drugs that are specific to certain health conditions, and sometimes, there's other step therapies, or they want you to try a different medication before you get to another medication, probably for safety most of the time. So it all starts out by you visiting the doctor, and the doctor gives you a prescription for whatever you're experiencing. Once you take that prescription, you go over to the pharmacy and the lovely pharmacy technician or pharmacist types up your prescription and boom, all of a sudden pops up on the screen, prior authorization required. Usually this is the part where the patient is getting upset because, hey, they've been spending all their time, they're not feeling well, and all of a sudden they can't get the medication. So what happens then at this time is that we send over a message to the prescriber's office saying, hey, the prescription needs a prior authorization. So this is when the doctor's office contacts the insurance carrier and explains, okay, the insurance will have some questions. Why are they taking it? How long have they been taking it? What have they tried in the past? So they can evaluate between the doctor and the insurance company if that medication is safe for you. Once that process is complete, they're going to come back with an approval or a denial. And if it's approved, usually they notify the pharmacist who can process the prescription to get it to you. Or there sometimes will be a denial. Sometimes there'll be a reason, hey, you need to try this first or this one, or we won't cover this one. And there is also usually a process for appeal. So the prior authorization process is a little daunting and it can get frustrating. As frustrating as it is for you, it is frustrating for the pharmacy also. We want to see our patients get their medication. We want to see them get it on time, and sometimes it feels like this process takes way too long. Over the years, there's been a lot of advancement and improvement. Now a lot of it's gone electronic and we can do it almost instantly, where we send the notification to the doctor and the doctor can do it right online. But it still can be frustrating, and we're here to help you. With that being said, let us and our team at Vesper Specialty Pharmacy be here for you and take care of your needs. You don't need to worry about that frustration of nobody answering your calls and not letting you know where you're at the process. We're here, we take care of things right away, and we're going to make sure to take care of you. Thank you all for tuning in. Make sure to like, share, and tag follow. We'll be back next week with Ask Dr. Drug Dealer.